Does your age matter if you want to move to Australia as a doctor? I get this question all the time. I'm 45, I'm 48, I'm 55 years old. Is it too late for me? The short answer is no. Age is not a barrier, but there are some important details around visas, permanent residencies, employers, and above all, your own stamina that you need to know. How does it practically equate to you working as a doctor here in Australia? So let's break it down step by step. Now, I'll be talking about work visas in the context of age, permanent resident visas, and what does it mean if you have got an advancing age. Do employers really prefer young doctors, specialist assessment and exams, and your age? What about the physiologic age and the workload? Can you really handle it? And a maximum age to work as a doctor. And lastly, I'll lay out my conclusions for you to make up your own mind. Work visas. Firstly, let's clear up the biggest myth. For most temporary work visa that doctors use, like 482 visa, there is no age limit. Same goes for 407 training visas. So whether you're 35, 48 or 55, you can still be sponsored to work in Australia as a doctor. Where age comes into play is when you want to move from temporary visa to a permanent residency. If you're applying for a point-based tested visas like 189, 190, 491, you need to be under 45. So once you cross 45, that option is basically off the table. But here's the good news. Doctors often qualify for special exemptions. That's right, being a doctor comes with its own set of perks. For example, on 186 employer nomination permanent resident visa, the standard age limit is still 45, but there are exemptions if you've been working in regional Australia or if your income meets the higher income threshold. And I can tell you for a fact that most of the doctors who are coming from India, Pakistan, Middle Eastern countries or developing countries would be working in regional Australia. They would have moratorium imposed onto them. Plus their income threshold would be certainly above 100,000, which would satisfy these criteria. On top of that, there are DA-MA agreements. Now, these are special regional deals that sometimes allow doctors to apply for permanent residency up to the age of 50 or even 55 years of age. So the pathway is still very much open if you are older. You just have to plan the visa strategy carefully. So that's why I always say it's often good to talk to a migrant agent when it comes to planning a strategy early on. Now, what about permanent residency? What is the reality there? Now, let's be real. If you're 50 plus, the government will not give you point-based assessment permanent residency. That's just a rule. But with Australia's ongoing doctor shortage, there are workarounds. Many IMGs in their late 40s and 50s come on 482 visa. They work in the regional or outer metro hospital, and then they transition to PR through employer sponsorship exemption. Now, that's very important. So don't panic, just understand that permanent residency takes planning if you're older. The point that I'm trying to highlight is that still working in that hospital, and there is a doctor who must be at least 55 and he'd been working in the same hospital for at least last 20 years. The hospital has actually sponsored his visa, saying that they need to have this doctor on board. So hospitals can play a crucial role when it comes to get a permanent residency for you. They have got a lot more say. For them, it's just another visa, but for you, it might be a life-changing step. What about the employers? Will they hire a doctor who's 50 plus? Now, that's another question I get all the time. Will hospitals or GP clinics actually hire me if I'm over 50? Because, that comes from the mindset that in Pakistan or India, the retirement age tends to be a lot younger. Most of the people would retire about 60, maximum 65. I've never seen someone, I might be wrong though, working in the age of 65 or 66 back home in Pakistan. But legally in Australia, age discrimination is not allowed. Employers cannot say no simply because you're over 50. What they care about is, do you have a recent clinical experience? Can you work the roster they need? Sometimes that means night shifts and weekends, extra long hours. Do you have a straightforward visa pathway, meaning that you don't have any complications in terms of your health and you don't have a long-term health conditions with complication in terms of requiring dialysis, or you have got chronic illnesses like tuberculosis or hepatitis and things like that. And here's the reality. Australia has a serious doctor shortage, especially outside the big cities. Clinics and hospitals in the regional areas are often desperate for medical staff. That shortage works in your favor, regardless of your age. And I think that's where most doctors, especially coming through the specialist pathway or the senior GPs who have got the required skill set, are able to come and work in area of need or rural areas or regional areas. I personally know many doctors in their late 40s and 50s who came through specialist pathway or as GPs, and they found work quite easily because the employers value their experience, and with their experience the skill set that comes. So the answer is yes, employers do hire 50 plus doctors, especially if you show recent practice and clear visa plan without much complications in terms of your health and family needs. What about the college assessment? Next question I get about that, do colleges have any limit on age when it comes to the specialist assessment of College of Radiology, College of Surgeons, College of Physicians? Because I do see many specialists working in India and Pakistan who've got experience of 10 plus years working in public and tertiary setups or private setups. So do they qualify because they've been working and they might be above age 50? Colleges like RACP, RACGP, RANSCOG, which is Obs and Gynae, ANSCA, they do not have maximum age cutoff. What they look for is your training, your recency of practice, and whether you meet the competencies when it comes to giving you a comparability assessment to that of an Australian trained specialist. Now, if you need to sit the exam as a part of comparability assessment process, the real challenge isn't your age. It's whether you have kept your knowledge sharp and can handle the exam stress. And let's be honest, sitting an exam at 52 feels different than sitting an exam at 32. But if you've been practicing and keeping up with your CPDs and you have got the right mindset, you've been working in academia, you can absolutely do it, I believe. So the hurdle isn't the college rejecting you because of your age. It's making sure that you have got enough recency and preparation. And if there's any restriction posed on you in terms of exam, you're able to meet that restriction to conclude the specialist assessment process. Physiological age and workload. So that's the another factor, which I believe it's perhaps the most important factor, and that's often overlooked, your physiologic age. If you come through the hospital system, you might be working as a registrar with the day shifts, evening shifts, and even night shifts in the mix on a duty roster. That can be physically and mentally tough at 50 or 55 years of age. I can tell you that. You need to ask yourself honestly, do I have an energy for rotating rosters, or would I prefer to move into, say, something more chilled like a general practice, outpatient clinics, or even supervisory roles, mainly in academia? Well, not too fast. In Australia, you will see doctors, shift their workload as they get older. Many move into GP, and many move into teaching or less physically demanding specialties. That's very normal. And when I say physically demanding specialties, I think all pathways head to a GP direction. So yes, you cannot come directly as a GP if you're not a specialist GP in your own home country. But if you're coming as a specialist, I've seen many specialists then transition to a general practice pathway, which is a real possibility. Because in general practice, the whole training component of the general practice, if you want to retrain as a GP, is only 2 years after the hospital component of 12 months. So even if you're coming as a very senior doctor or specialist, as a gastroenterologist, as an anesthetist, or even as a surgeon, you can just train for 3 years in a mix of a 1 year of hospital and 2 years in a general practice and be a full-fledged general practitioner. That is if you pass the FRACGP exam. That is an only component. But FRACGP exam, mind you, has got a pass rate of over 70%, and more than 2/3 of the general practice workforce are migrant doctors. So what is the maximum age to work as a doctor? That, I think, is a very natural question. Finally, what could be your limitation? Is there a stop at any point? No, legally, there is no retirement age for doctors. As long as you meet APRA's registration standard, recency of practice, CPD, and fitness to practice, you can keep working. Recently we've seen that many GPs in Australia are still practicing well into their 70s. During COVID time, thousands of retired GPs were invited back to cover workforce gaps. So if you want to keep going, you're competent, you're safe, you got all your bearings, you can practice as long as you like. So what are my summary and takeaway? Visas, no age cap for temporary work visas. Permanent residency after 45 is a bit trickier, but there are possible pathways, as I said, through employer nomination or through working in a regional area or having those particular perks which are unique to you. That is the income perk or regional or rural perk that you can factor into your application. Employers, they care about recency of competence, recency of your clinical skills and your clinical practice. And if your visa is straightforward, they're not focused on your birth year. Colleges, there's no official cutoff, but you must meet the comparability assessment requirements and possibly sit the exam if you've got the energy and zeal for it. What about your own age as a physiologic limiting time factor? Night shifts and the registrar rosters can be grueling at 50. So plan your specialty wisely or you move wisely. Working as a very demanding surgeon back in India in 3 hospitals and then thinking of working here as a specialist like a surgeon might be equally challenging, if not more. Retirement, there's no maximum age. You can practice into your 70s, but honestly, when you've got enough in your retirement funds, some of the doctors just take an alternative punt. They do into academics, they do go into teaching, research, just to get their mind going, but they leave the floor and go more into a mentorship role, and there are plenty of that. So does the age matter? Yes and no. It matters in a visa strategy, in a kind of work that you can handle, but it does not stop you from coming to Australia or having fulfilling career over here. If you're motivated, prepared, and strategic, Australia will have room for you no matter your age. Look after yourself and each other, and I'll catch you up in the next video. Thank you and goodbye.